Hi, and thank you for taking the time to watch my presentation of Newman's systems theory. A quiet, calm, and peaceful environment makes for a relaxing atmosphere for an interview. Don't you agree? Today, we're going to be discussing Betty's systems model and how we can apply this to our nursing practice. For those of you that aren't familiar with Betty's body of work, please take a moment to review some key points here. But because of time limitations, I'm going to be moving on, but feel free to pause as we move through the slideshow at any point. Here you can review the key points of Newman's systems model. And here is a diagram of a basic organizational chart showcasing the highlights of the systems model. The interview is going to be done in two parts. One, important questions that I'm going to use to help in my application of the systems model for my patient base. And two, a case scenario applying the model to an actual patient. Of course, the name's going to be changed in order to uphold patient privacy and HIPAA values. Question number one, what role do you believe nursing education should play in integrating your systems theory into practice? Betty responds, I feel very passionate about my systems theory. I believe it to be the most comprehensive to date, but my opinion may be a little biased. However, I feel it would be most useful in an initial patient assessment, integrating it into a review of systems assessment model and having prepared questions about the patient's own perception of their health and wellness barriers, focusing on subjective data, their stressors, told from the patient's perspective. If blended while teaching interview skills, we could ensure new nurses would learn the holistic interview and assessment of my systems model. Question two, can you elaborate on the importance of the environmental factors in your model and how they influence patient care? Betty responds, environmental factors influence the health and well-being of individuals. We see the client as part of a larger system influenced by multiple environments, physical, social, cultural, economic. These factors help healthcare providers understand the broader context of a patient's life. Stressors can be interpersonal, or extrapersonal. The environment can either support or hinder an individual's ability to adapt and cope with stress. Factors like social support, access to resources, and living conditions can greatly impact a patient's resilience and their overall health. Question number three, how can we as nurses apply your systems theory to our practice? Betty responds by understanding the model and how each dimension interacts with the environment and influences overall health. You gather your data about the client's strengths, weaknesses, and stressors within their environment. Then identify the stressors impacting their systems. Understanding these will help you develop targeted interventions, and then you develop your interventions that address those identified stressors. Use tools like education, counseling, and support services, and then put your interventions into action and continuously evaluate their effectiveness. Monitor changes in the client system and adjust your strategies as needed. My theory emphasizes prevention, so your follow up should include strategies that address current issues and prevent future stressors. And then regularly reflect on your practice using my framework. Adapt your methods based on what works best for your clients and stay open to new insights. Question four, how can the Newman Systems model be adapted to meet the needs of a diverse patient population, including Indigenous communities? Betty responds, while my systems model is a valuable tool for guiding nursing practice, it is important for nurses to remain flexible and adaptable, using their clinical judgment to tailor the model to fit the unique circumstances of each patient encounter. Question five, are there any limitations you've encountered in applying the model to specific patient scenarios? Well, yes, Betty replies. Variability can make it difficult to apply the model uniformly across diverse populations. When working with Indigenous communities, you'll have to adapt the model to incorporate traditional healing practices and beliefs. Success also depends on the nurse's ability to assess and identify stressors effectively. So, if a nurse lacks experience in a patient specific context, it hinders their ability to implement appropriate interventions. And also, the emphasis on prevention requires significant commitment, which can be challenging in a fast paced clinical setting where the acute care needs often take precedence, like in northern nursing clinics where you work, Angela. Part two, practice scenario. Pause here to review the scenario of Adam. Pause here to review the assessment. Pause to review Adam's stressors. Pause to review the interventions. Pause to review the plan implementation and evaluations. Pause here to review the prevention strategies. Pause here to review the conclusions. By applying Newman's systems theory to Adam's situation, healthcare providers can take a holistic and culturally informed approach that acknowledges the complexities of this identity as both Indigenous and LGBTQ. This framework enables a comprehensive understanding of his unique challenges and the development of effective interventions that foster resilience, well-being, and a sense of belonging. Thank you for watching.